strengthen the vibrant national societies in each of our countries with the hope of improving patient care. Today, as my term comes to an end, I would like to reflect not on the accomplishments, but more on the prospects, challenges, and opportunities that will define our future. As you may know, PAVSS was founded in 2022 with the goal of being a non-for-profit organization to promote best vascular care, education, and research among the vascular surgeons, vascular specialists, and vascular trainees in the Arab world. While focusing on the Arab world, we aim to provide an ideal educational forum and to play a key role in training, certifying vascular and vascular surgery, and even offering an educational resource for the vascular patients. We had several ambitious goals, focused on annual meetings, education, webinars, journal clubs, training, courses, and collaboration. So where do we stand today? Well, we are lucky that our MENA region is rich in talent and potential. We have dedicated vascular surgeons, passionate educators, centers of excellence that stand proudly on the global stage. And we're also very lucky to have a vast number of vascular surgeons and vascular specialists living abroad, in the US or Europe. Many of them have developed impressive expertise, assumed leadership roles in the vascular field, and are very eager to give back to their countries and region. We're also lucky to have respected vascular societies within the MENA region. So with their help, we're able to push forward. We started our annual meetings with the support of the EGVASC, and we did 4 vascular meetings so far, starting from 2022. We had our other vascular meetings in collaboration with King Fahd Medical School and in Riyadh, and with our meeting today. We've had webinars with impressive speakers, we've had journal clubs, but let's focus on the challenges. We have a growing burden of vascular disease and major disparities in resources and access. And that reality needs to be confronted. So let me highlight some of the major trends affecting our future and focus on diabetes, smoking, hemodialysis, and venous disease, which comprise our main practice pathways. Diabetes is a rising storm. It's increasing at alarming rate across the MENA region. If you look, we are among the highest prevalence in the world, Middle East and North Africa, around 17% and expected to go up 20%. If you look at the age-adjusted prevalence, in our part of the world, we're slowly going up, and now we're in the range of 80%, going to 19% and growing 20%. If you look at the number of adults with diabetes, currently we are about 72 million people in our region are suffering from diabetes, and that's excluding the pre-diabetics, and we're expected to go even higher. If you look at countries, well, Egypt is really leading the way with the number of adults with diabetes. All these are very scary things when you look at the impact of diabetes and the number of deaths, and we compare ourselves to the other nations. So we are like number 3 in the Middle East and MENA region, and we are in the 3rd group of worldwide death and number of deaths. And if you look at them by country, again, Egypt is leading the way and other countries. So what does that mean to us? There's a rising storm. We are expecting more increase in the diabetes-related complications and procedures. And we're going to expect an increase in the need of vascular specialists to treat diabetic foot ulcers, vascular interventions, whether open or endovascular, minor or major amputations, wound care centers, rehab centers. How about smoking? That's another persistent challenge and remains widespread. While smoking rates are declining in many of the parts of the world, our region is witnessing a persistent increase. Jordan is one of the highest countries in the region in share of daily smokers. And if you look at the number of average cigarettes consumed per year, well, Lebanon is on the top of the list. If you look at cigarette smoking or water pipe smoking, it's estimated that about 17% are cigarette smoking and 7% of the population smoke water pipe. We were at the restaurant yesterday and the whole restaurant was filled with water pipes. And all types of tobacco use, from e-cigarettes, e-cigarettes, cigars, all of them. And whether it's in Egypt or in the United Arab Emirates, it's all the same. You have a lot of, all aspects of cigarette smoking are being used. How does that translate? Well, we're going to expect a higher rate of arterial-occlusive disease, carotid aneurysm, and that's going to have an increased need for vascular procedures and vascular specialists. How about hemodialysis? Now that cardiac and diabetic patients are living longer, especially those affecting those diabetic patients, they're going to have more chance to develop and live long enough to develop advanced kidney disease. The number of patients requiring renal replacement continues to rise. So this is the prevalence of CKD is reported to be about 8% in the global, and it ranges from anywhere from 5 to 12%. And that's really an impressive thing. And when you look at hemodialysis and dialysis, the average overall prevalence of dialysis is around 350 per million population. Highest in Lebanon, lowest in Yemen. And when you look at the hemodialysis, again, it's pretty high in Lebanon. And here you have to talk about the impact of financial support. The sharp devaluation of the local currency in Lebanon has led to significant out-of-pocket expenses, leading to individuals dropping out from receiving care. And if you look at the public funding in the Middle East, well, we're lucky to have Jordan, Kuwait, Amman, Saudi Arabia, UAE, all of them supporting hemodialysis and dialysis 100%, but there are many other countries who are not having that strong financial support. And the cost of kidney replacement therapy continues to be elevated and stands to be among the highest in the world. Traditionally, vascular surgeons were the only one providing dialysis access, but now with new percutaneous AV fistula creation technology and other technologies, these are opening the field for other specialties. And access maintenance may shift towards nephrologists, interventionists, or other interventionists performing the vascular procedures. How about venous disease? That's another huge expanding market. It's rising sharply across the region. Patients are becoming increasingly aware of the treatment options. Radiofrequency ablation and sclerotherapy are considered among the fastest growing segments. And patients, governments, insurance are all increasingly aware of these therapies, and the expectations for minimally invasive, cosmetically appealing, with low downtime solutions are becoming higher than ever again. And this is the Middle East and Africa market, currently estimated to be around 386 million, and estimated to grow to 600 million within the next 7 to 8 years. So what's the vascular supply and demand? Well, clearly across the globe, low and middle income countries are experiencing a greater increase in the prevalence of PAD, AAAs, ischemic strokes compared to high income countries. And the demand for vascular disease continues to rise, for vascular surgeons continues to rise, but the gap in supplies continues to widen. Now this is estimates of the vascular surgeon in the MENA region in our area, but that's by no means going to be enough to take care of the vascular burden of disease that's available here. So let me give you a view of the future, or provocative potential view of the future. A patient arrives with diabetic foot ulcer. A healthcare provider photographs the wound. AI analyzes it and integrates the data with the patient's medical history. Non-invasive tests are performed. Perfusion is adequate, the patient is sent to a wound care center for offloading and care. If perfusion is poor, a CT angio or NMR imaging identifies the real disease. The patient is then treated by a highly trained technical expert, not necessarily a physician, who accesses the femoral or pedal artery, recanalizes the blockage using the most advanced tools. So I asked ChatGPT, I said, can you envision such a scenario? And what did they reply? Yes, one can absolutely envision a future in which the evaluation management of vascular disease, such as diabetic foot ulcers, becomes streamlined, standardized, and highly efficient through the integration of advanced imaging, protocol-driven pathways, and AI-enabled decision. I said, wait a minute, I want to know, can non-MD perform endovascular procedures? Well, ChatGPT says, for selected straightforward cases, the endovascular procedure may be performed by a specialty trained non-physician provider, someone who's not an MD but has undergone focused, standardized training in simple angioplasty and stenting. This would be done under clear protocol with physician oversight and reserved only for safe, non-complex lesions. And this concept is not entirely new. Similar models already exist in cardiology, interventional radiology, dialysis access centers in Europe and other places. As well, how about other procedures? AAA treatment, dialysis access, varicose veins. Well, for diabetic foot, yes, highly feasible for non-MD interventions in the future. Standardized imaging plus AI triage will help, and with simple angioplasty stenting could be delegated with strict protocols, as long as you have MD oversight for the complex lesions. How about AAA? Well, AAA, for sure, low feasibility for non-MD operators. EVAR is high risk and complex, and you will always need surgeon-level judgment for complication management. So the non-MD role will be limited to imaging, planning support, and follow-up. How about varicose vein treatment? Well, that's the most realistic area for non-MD procedures. Low risk, standardized procedure, whether ablation or laser or foam, already delegated in some countries. And the MDs will be left to handle complex venous diseases such as pelvic congestion syndrome or nutcracker syndromes or others. How about dialysis access? Well, already there are some existing models, and non-MDs are in some areas performing fistulograms and simple angioplasty and declots. And then the MDs will only be required for access creation or complex revision or treating infections. And then that's going to be based on large patient volume that will favor the STEAM-based approach. So then governments, insurers, and health systems may one day formalize these tests out of necessity, driven by cost, access, and workforce shortages. Now, this is not a threat. This is a call to lead. Unless we unite, develop a forward-looking strategy, we might find ourselves reacting rather than shaping this future. Now, the future of vascular surgery in the MENA region is full of possibilities. The techniques of endovascular and minimally invasive therapies are expanding rapidly, and we have the tools, we have the abilities to use them. The digital health and artificial intelligence and advanced imaging are available to us. But the most important part in our journey here is the training of the next generation. It is the most important element is our people. If we invest in their education, mentorship, and standardized training, we will elevate the care across the region and ensure that we have future leaders who will contribute globally. What this society must become is a home for young vascular surgeons, a platform for research and innovation, a hub for regional collaboration, and a bridge to global expertise. Collaboration is essential. Collaboration is the future. We cannot move forward in isolation. It has to be our foundation, and we have to collaborate with national societies, the global vascular organization, neighboring societies. Vascular disease is complex, and no specialty can tackle it alone. I stress the collaboration issue because this has been one of the challenges. We want to support our national society, our national societies. Our mission is not to compete with the national societies. Please pass on this message. Our role is to support them. We want to amplify their voices, collaborate with them on their national meetings, and elevate the care where assistance is needed. We want to complement, not to replace their annual educational activities. Now I want to take the opportunity to acknowledge my colleagues, the board of directors, starting with Dr. Mus'ab Salman, who gave us the opportunity to launch our first PAVSS meeting in collaboration with DG Vascular, and this has become an annual event. Dr. Khalid Al-Omar, who allowed us to progress and move to Riyadh and have collaboration with this center, with the help of Dr. Samir Qusayr, who has always been present with his big smile and his pleasant personality, helping everyone. Dr. Yazan Duwairi, who has maintained the US standards and focused with us on everything we're doing in our meetings. Dr. Hassan Al-Thani, who has been focusing on the board certifications and pushing that forward. Dr. Shireen Shalhoub, who also has been mentoring and pushing with the diversity issues, as well as offering all her skills and knowledge in aortic surgery. And here I have to have a special thank for a very dear friend, Dr. Muhammad Omar Al-Farouk, who has been missing the last 3 meetings of the PAVSS meeting, whether in Riyadh or in Amman. Dr. Omar Al-Farouk has been one of our most supporters as a director on the board. He is a guru in artificial intelligence and everything related to IT. He has numerous courses, and due to several issues, he was unable to be with us today, but he's always with us in heart, and we certainly hope that he will be with us in future meetings. Special thanks to my dear friend, Dr. Hani Zaid. He, as you can see, he has put together a wonderful program, and he's always on the lookout for international collaborations in Europe, and we certainly appreciate his support. And a huge thank to the big smiling face of Dr. Munir Nazar, who has been holding the PAVSS in Toledo, doing everything necessary to get the non-for-profit status, collaborating, moving along, contacting people, trying to appease whoever is upset because they did not get an invitation by mistake or this or that. And finally, my very dear friend, Mahmoud Bashir, who I'm so delighted to be passing the baton to him, because I'm confident that the society is going to be in perfect hands and in safe hands with his wisdom and commitment and support. So in closing, I'm deeply proud of what we have built together, but I'm even more excited about what lies ahead. We have laid the foundations. Now it's time to push the frontiers. There's still a lot to be done. Let's get together, let's unite across borders, let's support one another, and let's collaborate globally, innovate boldly, and lead with compassion. This society is young, but it is your society. Again, it is your society. Its potential is limitless. Together, we can shape the future of vascular surgery in the MENA region. Thank you very much.